Welcome to The Second Opinion. I'm Rosemarie, and if you've ever wanted a second opinion on some of the trending topics in health and wellness, you're in the right place. Each episode, I sit down with experts, innovators, and even a few disruptors to bring you fresh perspectives on the issues that could change your life, from age rejuvenation and brain health to the weight loss drug revolution and how to reinvent your career. Together, we'll dig into the latest research, question what's hype and what's real, and give you the insight you need to make your own choices about health and wellness. So, if you're ready for a second opinion that's engaging, enlightening, and maybe even a little unexpected, let's get started. Today, I'm talking with Dr. Cliona Cosgrove about mental health and mindfulness. Cliona is a clinical psychologist, mediator, meditation teacher, and mom of 3 young children. With her vast experience and holistic approach to mental health, she works with both adults and children to address a wide range of mental health challenges. As someone who juggles multiple demanding roles, Cliona brings a unique and personal perspective to her work, especially as she navigates life as a perimenopausal woman. Her ability to integrate psychology, mindfulness, and meditation into her practice offers insights and solutions for the complex mental health needs of individuals and families.
Wow.
I know. You have a lot of impressive street cred.
Thank you.
You're welcome. And I just wanted to make sure I got all that in there so our listeners know exactly who they're, who's on the podcast. So with that, thank you so much for being here.
Rosemarie, you're so welcome. I'm very excited. Coming all the way from Ireland for this.
Okay. With all of the street cred that I read, you do so many things, right? And I think too, a lot of mental or healthcare professionals, a lot of medical people, which you are, their biggest job comes when they actually get home. But with that being said, what actually drew you into this area of clinical psychology?
Yeah. Oh, well, it was never the plan. As a teenager, I was more drawn to the artistic world, and I wanted to go to art college. I wanted to do graphic design. I wanted to get into marketing and manipulate people into buying things. I thought that was a glamorous world where I was going to make loads of money. And I am from a family of non-risk takers. So I think that path really brought up a lot of anxiety, especially in my dad, who was in the Irish police force for his entire career. So that idea of, going down a path that had a permanent and pensionable job at the end of it was extremely important to him. So he sat me down and gave me a bit of a talking to and coaxed and persuaded me to consider a career in psychology. And I was extremely naive. I think we all were, because it was a very, very long road. So I got into psychology. I did like a 4-year degree in Trinity College. And in the middle of that, I had just let go of the artistic world and realized that actually, there wasn't as much realism in that as maybe I had anticipated as a 15, 16, 17-year-old. And probably, kind of midway through my degree, realized that actually I have the personality to serve people and to help people. So in my naivety, I left college and thought that I could work as a clinical psychologist or work as a psychologist. But you can't. With a degree in anything, I don't think you can really get a job. So 24-year-old Cliona went on to do a master's in health psychology. So I specialised there in adolescent health behaviours. And lo and behold, after 2 years of a master's, I could not work in the Irish health system. I needed clinical psychology, really dictated jobs in our area around that time. And luckily, in the last few years, things have changed with that regard. So I was on the path then to clinical psychology because that was the only real way that you could get that permanent and pensionable career here in Ireland. That was another 3 years, but I needed 2 years of work experience. So all in all, it took 11 years to get out of university with my pieces of paper to be able to work in this field. So it was a much longer road than anticipated for 18-year-old me didn't know what she was headed for. But I'm glad now that I did that. And I think you and I met each other during a meditation teacher training, and we can talk a lot more about that later. But, I don't think I would have chosen to do that course without having the background that I did.
So I always say there's no mistake between the fusion of why the schools of arts and sciences are always together in the same building, because so many people in a medical background, believe it or not, have a very artistic side. I mean, not everyone, right? But there's a lot of us that kind of coexist in both worlds. But like you said, it's also a very long road. Yes, it's predictable. We know if we can get through all those arduous exams and pass and do well by patients, there is a light at the end of the tunnel. But a lot of that takes a lot of time and a lot of dedication and consistency, which some people go into different fields. So we stick it through, us health and medical people. But with that, it also pushes back our timelines as far as our own life. So how did making these decisions, which we don't think about when we're in it because we're just trying to stay afloat and just get to the day to day, did those decisions impact your personal life?
Oh, 100%. I wouldn't say that they impacted the person I have ended up with. I think my husband and I, so while timeline definitely has affected us settling down and having kids and that kind of trajectory, and kind of, it's only in hindsight that window of the childbearing years was closing before I'd even awoken to that concept. But no, John and I met when I had just graduated. But I suppose the way that it impacted on our relationship was the fact that I needed to give back an extra 3 years. So the health system in Ireland paid for me to be trained. We have a wonderful system of education here in Ireland. So I did not leave university or my master's or my doctorate with massive loans. And I can imagine in the States, that's a very, very different situation for people when they leave university. So I didn't have that. And yet I was still starting out at like 30, 31. So I had a job that was in the west coast of Ireland. Now, Ireland's a tiny country, so it was only 3.5 hours away, but we did live apart for those first 3 years that we were dating. So getting to know each other, getting to have those conversations about settling down, marriage, babies, and all that was probably put off for a few years. And it definitely impacted on that settling down financially because, I did have my doctorate in clinical psychology, was working in the field. But like most jobs, I was starting from the bottom up then. So I was staff grade, paying rent, all of that kind of stuff. Yeah. And it was only after we got engaged that I got a senior post, and things just moved really, really quickly to us getting married, having kids, and settling down on the East Coast. I was able to move then. So yeah, I mean, it didn't impact on me meeting somebody, which I know can be the case for a lot of people who spend a lot of time in education and spend a lot of kind of devotion and kind of, as you said, getting all those exams and reaching the perfection of in that career. And I have to say perfection because that would definitely be one of my traits and probably was one of the driving forces behind me doing all of those years of study. Was that perfectionistic part. But yeah, for me, I think it was more the financial stability and that distance that my career, when I was starting out, actually put in place for myself and my now husband. And as you said earlier, when you're in it, getting the degrees, getting the qualification, getting the experience, starting the career, your mind can be very, very focused on that one piece of your life and that snapshot in the here and now. So for me, the idea of that window of fertility, it was never there. And it only kind of came as a wallop to the face at about 33 years of age, when it seemed like there was this tsunami of friends of ours having babies and getting hitched and buying their first house. And I was like, oh, hang on a second, where's this boat that I was supposed to hop on? It seems to have left the dock without me. And it led to conversations that my husband and I had never had. Things like, how many kids do we want? Do we want to settle down? Do we want marriage? And there had been this a misperception, I think, on his part about what I wanted. And in his mind, it included a lot of, big rings and big dresses and things that we couldn't afford at the time. And once I established that that wasn't actually what I wanted, not the big ring, I want the marriage. Within
Right.
7 months, we were married. And within 2 months of that, then we were pregnant with our first child. But I was 35 having my first child.
35. Okay. So it's interesting. Once I decided I was going to approach you about this after our conversations going back, I dug a little bit and I found quite a few articles, more than I thought I would, whether they were from Harvard Business Review and some other articles and statistics that I thought were interesting. So I'm going to share these stats with you.
Mm-hmm.
So these are US statistics, and then maybe you can chime in from across the pond. But of all the live births in the United States during 2021 and 2023, the number of women having children past the age of 30 is increasing. 47% of live births were to women between the ages of 30 and 39. About almost 4% were to women older than 40. And this is while the birth rate for women in their 20s has decreased. 45% of women births were to women ages 20 to 29. So I found that to be really interesting. And a lot of it too, it's like a lot of women are not, there's the choice factor, right? It's not that they're really like, that's what they're choosing, but you're putting other things first. And then I want to hear your thoughts on those stats and why do you think this? You talked a little bit about financial considerations, career considerations, fertility, and also dating has changed. How we meet people. Also.
How we meet people. Yeah, absolutely. I suppose just when you're saying that the similar stats are happening in Ireland. So our Central Statistics Office, the most recent census, I think, was around 2023. And what they have found is that kind of gradually, since 1995, when we first started collecting this type of data in Ireland, every year the birth age is going up. So it's more likely to be women over the age of 35 to 40, and the women 20 less are going down. So it's really interesting that this is, it seems to be a worldwide or definitely a Western society phenomenon, and it's happening across the board.
Yeah, I find that interesting in Ireland because Ireland has always, being of Irish descent, a very traditional country in the fact of like it was very defined, like women, or just who did what in the household, right? Was always very traditional. So that's interesting.
I think we still have some conversations to have in Ireland around who does what in the household, because I think while we are, and this might be a global phenomenon as well, but in my experience and the kind of moms I'm meeting in my clinic and through the parenting programs that I'm running, it's like we gained this new world where, and in Ireland, it wasn't always the case that women could access university level education. That is a new phenomenon. So we gained the university degrees, we gained the jobs, and at the same time, I think we're adding that on top of all of those traditional roles. So quite recently, I was just making a list of all of the things that I take responsibility for. And I would be really interested to ask my husband to do the same, just to compare and see, in each other's perspective. And like, it's not a battle. It's not a competition. But it is my lived experience that, I tend to be the nurturer. I tend to be the one who's more kind of psychologically there for the children. And I'm the planner, and I'm the organizer, and I'm the healthcare person, and I'm the organizer of the house and the laundry. If I could just get rid of the laundry, my life would be so much easier. So there's all of that. And I'm working with suffering families and young people with mental health difficulties on top of that. So it seems like there's a bit of not being able to let stuff go, to take more stuff on, for women, especially women who are, also living in a career.
Yeah. So would you say anecdotally then, it sounds like a yes, but just to be clear, anecdotally, you're observing amongst friends, peers, and maybe some people within your practice as a 30-something with young children. So older, being a more experienced mom. I hate the word older. I'm trying to say
geriatric. That's the word you wanted to use.
That is the best one. Geriatric pregnancy when you're past a certain age, because right. There'll be a lot of geriatric mothers in Manhattan. I'll tell you that's primarily geriatric.
I was geriatric at 35. And then I had my second child at 39, and she said, "Oh, you're just on the geriatric list." And I was like, "But I was geriatric like 34 years ago." And she said, "Oh, no, we had changed that." And I was like, "Well, I did not get the memo." So in my mind, I've been a geriatric since I've been 35, which didn't go down well at the time.
Yeah. So that will, perfect. Then segue into my next question or my next thought. So you have all these hats, you've done all these things, you've got so many experiences. How have these experiences collectively shaped your perspective on mental health as a perimenopausal woman?
Wow. I think every woman, and I'm speaking to women here, men too, but I mean, we're talking about my experience. We all wear many, many, many hats. Being an older mom has shaped my perspective in that I have always been a person to wear my heart on my sleeve, and maybe in the past be an oversharer. And I was taught in my clinical training that, because I didn't have kids then, none of us had children in our cohort when we were doing clinical psychology in Trinity. And, the question often came up, what do you do? Like when a parent asks you, do you have children? And the response from the professors was always something like, "Oh, well, just ask them, it's curious. Why would you ask me that question? And I'm wondering about that," and kind of putting it back to the parent. Which doesn't sit well with me now as a 45-year-old mom with 3 kids. So it's given me that perspective that I can 100% empathize with parents going through a similar experience to me. I'm parenting a 9-year-old, a 6-year-old, and a 4-year-old. And I'm 45. I'm going through hot flashes. I'm not sleeping. My joints are sore. And I'm meeting these moms in my clinic. So it gives me a level of empathy that I probably wouldn't have been aware of before. And as you say, I'm a meditation teacher as well. So that has kind of, doing the meditation teacher training has given me a way to contain that heart on the sleeve personality trait. So I'm not closing myself emotionally to people, but I'm definitely giving myself the space to reflect on what my experiences are as a woman in her 40s, as a mom of small kids, and as a psychologist. So all of those hats are all threading into one way of being in my profession and in parenting my kids. And it's one from a self-disclosure stance. It's one from a regulated emotion stance. And it's one from just pure empathy for every parent that I'm dealing with. And more so I'm recognizing that it's that self-disclosure. It's that piece of being in the lived experience and understanding where the people are coming from that can bring about the change and the support for the families I'm working with.
So for someone listening, clearly we met in a meditation teacher training. And yes, and so we've worked on other things, right? So things that we can't control, we took meditation to help us with that. So with that being said, would you change? You wouldn't change then how you don't have any, again, the word regrets I use loosely, but if you had to do things differently, would you no? Or what are your thoughts on that? Do them exactly how you've done them.
Oh, that's a really lovely question. No, I don't have any regrets. It's a tough one, and bringing it back to, the way that I'm approaching my practice now practice is my meditation practice, my parenting practice, my work practice is in the here and now. Right. So, we go through these experiences because we're supposed to go through these experiences. I don't think 30-year-old me would be as good a mom as I am now. I think, there are so many, and we can talk about like the pros and cons to being a mom in your 40s and going through this crazy incongruent period between changing diapers and having hot flashes. It's like those two things, evolutionarily speaking, shouldn't actually coexist in the same sentence. And yet here we are in a society where it's so regular. It's happening to, like, the school gates exam, for example, for me, I'm pretty much, it's the average age, 45.
No, it's so funny because I talk to my friends with kids who had children later. And, we all in jest, they say things, if I would have known this is, or they'll say things, if I'm past that. But when I was still at that potential where I could have possibly been a mom naturally, don't do this. It's for young people. They would say things like, don't do this. It's a trap. Don't do it. Learn from us. Do it another way. There's all different ways to go through this. So I make light of a situation that's very, very, like, you're not missing out. If we could have if I could have a night of but it's all in jest and fun. But but these are different. These are interesting conversations. Like just talking about why women. If someone doesn't have a child, it might not be because they didn't want that. It just didn't work out that way.
And can I just say, Rosemarie, I know that you have, there are children in your family. So just because you're not a biological parent, you are still part of that parenting narrative and that parenting experience. So, having that medical background, having that life experience, having the meditation. And I say this to all of the people that I work with who are in contact with kids. So we're living in one of the most amazing times where actually our generation are so much more self-aware. I'm not blaming our parents for this, but we are in this time of our existence on this planet where we're so much more open to, pushing the boundaries of social norms. We're so much more open to apologizing to our children. I did a program. Sorry, I'm on a rant now, but I did a program with a group of parents, an emotion focused skills training program for parents. And I asked the entire room, had anyone in their lifetime as children had an experience of their parent apologizing to them? And one person put their hand up in an entire room of parents. And I was like, I was expecting that. In fact, I wasn't even expecting that one hand to be up. But here we are now as a generation showing up for our kids and questioning that age-old narrative and those conditioned beliefs that we had from our childhood and changing and rewriting it for our kids. And, back to your question about would I change anything? No, I wouldn't, because I wouldn't have that perspective now for my children if I'd had them younger.
Okay. So that's beautiful. Yes. Which is why you're so good at what you do. And with that, using that feedback that you gave to me, thank you so much. Say if someone's listening and they're struggling, they're an older mom, what are some of the things, besides some of the things that you just shared, that some strategies maybe that you can offer up to them who might be listening?
Sure. Because if you are an older mom, there are daily struggles. To be honest, if you're a mom of any age, there are daily struggles. But put perimenopause on top of that, it's like, I thought I was going crazy about 6 months ago. And it was one of the things that really, really struck me was the lack of awareness, because my husband's not going through his lifetime. He's not going through the same hormonal fluctuations on a cyclical basis that I am. I think men's hormones, I don't know the science behind it. You might be able to tell me, but they don't dip and, ebb and flow as much as ours do. So I think if you are a struggling mom, and you'll know this from your meditation teacher training, the law of impermanence, that Buddhist idea, and you don't have to be Buddhist, you don't have to be religious or spiritual to even bring this thought to your mind. But if you can, when you are struggling, bring this idea that nothing lasts forever into your mind, it will ease that suffering in that moment, because nothing, even the good stuff, doesn't last forever.
Yeah.
Do you know?
This too shall pass, right?
this too shall pass. And even I was on a rant earlier with you about the laundry, like putting that idea to this cycle of laundry. I have 3 children, a husband and an au pair living in my house. There are 6 people living in the house. And I had this, such a perfectionist. I was like, every day I'm going to try and get to the end of that laundry basket. And it's like this metaphor for life. Like, where am I racing to? What? Like, if I finish this laundry, there's just another pile that's coming down from upstairs to add to that. So this too shall pass. And laundry is a cycle. It's a process. It's not an end. It's just a process. So that's really helped me. Another one in that vein of kind of meditation, and a lot of these tips that I have and things that have worked for me are because I did a meditation teacher training, and I'm bringing it to pretty much every orifice of my life. But if you can consciously let your shoulders drop when you exhale, even a few times a day, you can allow yourself to create some space. And when we get space, we get clarity. And when we get clarity, we get a bit of distance between whatever that stimulus is. And in my life, it's usually a 4-year-old who won't eat the dinner that he loved 2 weeks ago. And he's having a temper tantrum because I don't like the pasta that way, or I didn't like that sauce. Or it's the 6-year-old refusing to go to bed, or it's the 9-year-old telling me that she did her homework and after school, and then I realized that there was no homework. So all of those daily irritations can be made so much easier by just creating a little bit of space and being curious. It's so important, because we live in this world where we are reflecting. If you are a meditation practicer, even if you just, breathe for 16 seconds a day, consciously, you are in the business of reflecting on yourself and reflecting on your own emotions. But there's not many people that do that. And while you're breathing, you can be curious of what's actually going on internally. And that brings me to another tip. If you can be curious of what's going on internally, then you give yourself a little bit of space to understand what your own emotions are. Because one take-home message from the program that I run with parents is that you are not responsible for your child's emotion, nor is your child responsible for yours. And yet all the emotion that we experience is valid. So it's so important to do a deep dive into emotions. Google, what are emotions? Why do I have them? Because if we don't understand them as parents, then we can't rewrite that narrative, and we can't model staying regulated for our children. I just think that's so important. There's a beautiful video that I use quite regularly with parents, and it was developed by a Norwegian lady called Anna Hilda, and she has developed this emotion coaching skills for parents. The video is called A Short Story on Emotions, and it's Alfred and Shadow. So if you go onto YouTube and look up Alfred and Shadow, A Short Story on Emotions, that's your deep dive into understanding why we have these things. And it'll give you really good insight into, when we get triggered by our kids, chances are that's actually some of my stuff being triggered and not necessarily my child. If I can sit in what's been brought up for me, I can tackle that, I can regulate that, and then I can see my child and meet my child where they're at.
And that's very useful, especially when we have all these hormonal, like you said, your own hormonal things going on, your child's growing as well. So it sounds like you are naturally, the strategies that you're sharing with us, they're also spill over into your practice. So it sounds like things are very intertwined.
Absolutely. Yeah. I'm bringing meditation definitely in every single step of my practice, but also the story. I think that's why group work with parents and workshop work with parents is so beneficial. And definitely as a facilitator, being a mom, I can bring those anecdotes, I can bring those stories of when I have lost it and when I have not been regulated. And, teaching parents that actually we are not trying to make you a perfect parent. In fact, being a perfect parent or being a perfect human being in the world is not what our children need, because if they are living in perfection, then they have their first breakup or their first disappointment. They are not resilient. And that's actually
Yeah.
what I'm seeing in my clinic when I'm working with a lot of teenagers who, you know, life was perfect till I hit the teenage years. It's like, well, of course life was like, nobody's life should be perfect.
Right.
So nobody's parents should be perfect. But, you know, I'm teaching these parents that actually it's really important to be able to go back and apologize and own your own emotion. If you can go back
So
and apologize to your child, it teaches them that they can actually take responsibility for their own behavior and thus be resilient. Yeah. Sorry.
No. I'm sorry because I have a lot to ask you, and I just it's so naturally like a conversation. I forget there's a camera on.
Okay.
All of this it sounds like that all of these your own challenges are actually almost making you. I mean, it's actually not making you better. I don't want to use that. Maybe more understanding to some of your patients,
Yeah.
like what
Yeah.
they're going through, both parent and child.
Yeah, definitely. And I think it's giving me, I think I've definitely gone through life like most of us do with that imposter syndrome. You know, you're kind of
Yeah.
waiting for someone to jump out of the bushes and tell you you're a fake, you're a fraud. And I have constantly said that being a psychologist has not made me a better mom, but being a self-aware meditating psychologist has made me a better mom and has made me a better therapist to other moms and other parents. It's kind of, I mean, it gives you a sense of grounding in that. Like, I don't have to know all the research. Yes, I've done all of the qualifications and I have that foundation. And yet it's only until I've stepped into my role as an emotion focused meditating parent that I've actually been able to go back and go, lads, do you know what? This stuff actually works. And these are my reasons why. So that's really
Yeah.
helpful.
So, do you find as a woman that is going through perimenopause, navigating a career and small children, did you find that it was difficult as your own exploration through meditation, but also just dealing with this specifically with perimenopause? And maybe you can share you and what your friends find and within your practice. Is it difficult to find information? I know you're bringing your outside experiences to your parents and, helping them navigate their kids.
Yeah.
But is it challenging finding information, or do you find there's more information now that's geared towards older parents? Because I know a lot of women that are going through this, but they're like, can you believe they said that? Like, they're even dumbfounded with some of the questions they get asked from doctors and from, other people.
The more I consider this and talk to friends and other, parents that I'm working with, there's a lot of talk and chatter about this while people are going through it. But those conversations and that education actually should have happened when we were doing our sex ed program in primary and secondary school.
Right.
So actually what I've started doing now, my daughter's 9.5 years old. We're having age appropriate conversations about, bodily changes and hormones. And I'm giving her the information about, well, actually what's happening on the other side. So, she's 9.5 now, probably from next year, she'll be heading into those preteen, teenage years, and we'll be going through this fluctuation together. So rather than I have memories, and most people listening to this will have memories of their own mom going through this. And it's only in hindsight that we're like, oh my God, yeah, that must have been awful for her. At one point, I thought my parents were having a divorce. My mom was crying all the time. Is she depressed? What the hell's going on? And actually, in hindsight now, I'm like, oh, goodness. Yeah, I was 19. She was in her mid-40s. That was menopause. That was perimenopause.
Yeah.
So, yeah.
No, I think that's a great point that you brought up, because now things are much more open, where there was a time my mom, she's probably going to laugh when she listens to this. At one point she was going through something, and then she started going to the gym, but she didn't tell anyone. She had never worked out. She was going to the gym. And then she was like down, and then she was up, and I'm like, are you having an affair? She's like, no. And I was like, it was just funny. And she looked at me and started laughing. I'm like, I don't know, you're all over the place. I'm just like, as your child, it was just really, really funny. She's like, I don't have time to have an affair. And it was just really, really funny. But because we didn't talk about those things. And now here we are, we're the generation, we're like, what the hell's going on?
So there is, there are more conversations. We are sitting here having this conversation that this is a real phenomenon that's happening to all of us. and it will
Yeah.
happen to all of our kids if they are female. At the same time, the information, I definitely struggled with, like my general practitioner was like, with your hormone levels, there's no point in testing your hormone levels because that's not going to tell us if you're in perimenopause. And it's this real limbo land. Either you're, like, as far as the GP was concerned, you're either in it or you're not. Whereas actually, think about it as a process. Like you're in flux sometimes and then you're back out. Like, oh, these hormones are like a big wave. And the only
Yeah.
time that you actually know whether you've gone through perimenopause is when your periods stop and you're menopausal, and so you've gone through it and it's finished.
Yeah.
So that was really confusing with me. So definitely, if anyone's dealing with physical symptoms or psychological symptoms, like, a fluctuation in mood that feels like cyclical, or I used to wake up with, before I started on HRT almost 9 months ago, and definitely still have quite a few symptoms, but the reason I went to the GP was because I had what I call the heebie-jeebies. I would wake up at 2 o'clock in the morning, and cognitively, I'd be thinking through my day, thinking through my work, considering everything, and there was nothing overly stressful going on in my life. And yet I was having this physical, biological fight or flight feeling in the middle of the night. So that was one of my major symptoms. And then when I tracked it, it was 2 weeks before my period. So then I brought that data and that information to the GP, who said, okay, here's a checklist. Let's look at the symptoms. And I think by the time I ticked the 10th one, she was like, oh, okay, maybe this is something that we need to consider. Maybe bioidentical HRT is the thing for you.
So here's a question. Because I know you're the mental health space. Are you bringing this up to, say, any of the moms, or I know within your group of friends, but have you had talks with your patients' parents about this, or no? Is it just strictly just your friends?
I mean, I work, my contract and my day job is to work with adolescents, but actually I'm working so much more with parents and not actually, for want of a better word, pathologizing the young person in a family system. So that's, I suppose, long term, that's where I want to move my practice to, is this holistic kind of looking at the family system and working from an emotion perspective. So yes, I am working directly with moms. And I do bring that up if they are really at the end of their tether and bringing a lot of overspill of emotion into the sessions about their child. I will have those conversations and I will disclose that, look, I'm the same age as you. I am going through similar experience, and maybe you need to talk to your GP about this. I'm not a medical doctor, so I wouldn't be prescribing what they should be doing, but I would bring it up as a wondering and as a curiosity.
Let's talk about your meditation, how you bring that to your practice with the moms or the kids, both, but since we're talking about the moms, and is there a study, without violating any kind of privacy, talk about, maybe give an example of how meditation helped someone in your practice?
Sure. It's in every part of my practice. So one of the major parts of my role that I've kind of honed this for myself is doing workshops for parents. So I'm part of a group, and we run online emotion focused training for parents. So it's for moms and dads, and usually it's through the adolescent service. So usually these are parents of young people with severe emotional dysregulation, self-harming behavior, suicidal ideation. So these are parents at the end of their tether. And this is a 5-week program. So I inherited this program, and it was really like a psychoeducation program. And I came back from my David G training in California 3 years ago, armed with all this meditation stuff. And I interwove that. So it was a regulation program to support you, parents, to figure out, well, what are my emotions in this moment and how am I triggered by my child's behavior, owning that for themselves, and then giving them skills to regulate. So we start off with some breath work. We do some guided meditation. We do some metta love and kindness meditation. And the feedback I've gotten from those parents has been phenomenal. And actually what they find is the one that gives the the biggest agent of change for them is that 16-second breath work that you and I would have learned from David G. So breathing in for 4, holding for 4, letting go for 4, and holding for 4. And I teach them to do that before they even put their feet on the floor in the morning. So getting incredible feedback. And what parents are saying is that it's giving them that space between the stimulus, which is their child's behavior, and their reaction. So they're giving themselves space to respond. And then I have one example of a mom recently with, I'm just working with her. Her child is referred to the service, but I don't believe that I need to meet with this child. So this mom has had a significant trauma background herself. She's the same age as me. So not only has she a lot of kind of trauma focused work to do for herself in her own therapy, but she's in the thralls of perimenopause and doesn't know, she can't kind of figure out which is which is me, which is my child, which is my hormones. And so I'm literally sitting with her and teaching her some mantra meditation. And she came back to me last week and she said that one of the reflections that she had was, it's me. I am a driving force for my children's behavior. Yeah, and that she has had opened up conversations now with her child and with her child is attending the service, but she has more than one child. And being able to say to her children, I've reflected that this is something that I do and I'm sorry, has been this phenomenal for her, where it's opened the floodgates for her kids to feel secure enough to be able to say, well, Mom, we feel scared sometimes. And she's like, oh my goodness, there's a lot of work I need to do. But being able to sit in the present moment has given her that tolerance of all of these difficult feelings that she has been holding her entire life and projecting to her children.
Well, it's beautiful because just this shift, it's as small as it may seem, but it's really not, or maybe it doesn't seem small, but just this one sort of adjustment now is going to affect, who knows how she was parented, but then also like that's huge, a huge awareness for her.
Yeah. And I suppose the biggest thing, and I think if you take any psychological symptoms, if you can bring it down to what is the emotion that's showing up in this moment right here, right now, then you can name it, then you can be curious about it, and then you can learn to sit with it and tolerate it. Like emotions, this mom has said to me, I've learned that emotions aren't something to fear. And we as human beings spend so much of our existence trying to avoid, push down, and in the adolescents that I work with, self-harm emotions away. When in actual fact, the therapy, it doesn't matter what you couch it in, cognitive behavioral therapy, dialectic behavior, emotional focus, whatever it is, actually, it's about sitting in the here and now with whatever is brought up, tolerating that and allowing the emotion to do the job that it needs to do and not get stuck. So what's happening with us is as we get older, we've got a lot of stuck emotions. We've got a lot of, the stuff that we learned as children. And for me as a parent, that gets triggered in the here and now with my children. So I have a very strong need for my identity, I really clung on to Dr. Cliona for such a long time. And the ability to be able to let go of that. And, you can have all of the PhD, MD, whatever at the end of your name. And then you have a child not going to bed in front of you. And all of that goes by the wayside and your old childhood fears and shame come to the fore. And no matter how much training you have, it can be very, very difficult to sit with that. But that's what meditation has done for me. That's what emotion focused work has done for me. And that's what being a mom in my 40s has done for me.
Wow. That was a lot.
Sorry.
Thank you for sharing that and being so authentic. So, because I think a lot of people, well, I hope a lot of people listening, it's going to inspire them or maybe not feel so alone if they're listening to this. What would you say? And especially the part, like, no matter what degrees you have, you still feel this way. So if somebody, like even if you have all the information, it doesn't always make it easy to act on it, even if you have it. So say if somebody is listening, what are just a few practical tips before we start wrapping up here? Can you offer them to prioritize their mental health and self-care. And maybe, I know I'm going to also throw one more thing in so you can answer all at once, but also you mentioned community a lot, like in your group of friends. So if you can talk about some tips and the importance of community.
Well, I don't know if you've done any deep dive into the research. There's so much research on the importance of community and friendships in particular. Mm-hmm. Anecdotally, for me, it's been my book club. It's those ride or die group of about 12 women. We meet each other. Not everyone's there every month, but we meet each other, probably talk about the book for about 4.5 minutes. And then we get into the nitty gritty and we have that WhatsApp group where we, chew the cud and really give each other some direct advice. So really all you need in your life is 3 friends. That's what the research says. And, having friendships, having community is directly correlated with a sense of psychological well-being. So I think if you have connection with anyone, that is so important. And also be aware that connections will come into your life and they will do what they need to do in the timescale that those people are in your life. So if you notice that there are connections that you're having that aren't necessarily meeting your needs, you can allow yourself to let go of those to bring more in.
Yeah, that's very helpful because it's funny. Some of my friends that, and other women might be listening, like friends that we were very good friends in college, and then we all went off on different paths, whether they got married and had children. But what's bringing us back together is all menopause, because we're all going through that. I might not have kids, but we're all going through menopause and perimenopause. So now all of a sudden they're like, hey, Rose, what do you want? They want to know, like, what are you finding out about this? Because we're, so I think that's great. Like you said, it doesn't matter. It's just that we've got this thread and you might be professional, kids or no kids, but it's just finding that important.
Absolutely. It's bringing us all back together again. Yeah. And having the conversations is so important. The education might not necessarily be in the system yet, but I mean, we know our own bodies, we know our own cycles, and I think it's really important to give that information to each other and be really open with our friends about that.
Great. Well, anything you would like to say that we didn't cover? Because I know we could go on and on about this, but anything that you really felt like you called to that you wanted to talk about today with?
I am just so thrilled to have been here. I think we've pretty much covered everything. I just want to just say to people, if you are a mom in your 40s and you're struggling, talk to your friends, talk to your GP. Dr. Google isn't always very helpful. But it is a thing called Insight Timer. It's an incredible meditation app. It's free. Download that, do a 16-second breath work. Just let your shoulders drop and tell yourself that actually whatever I'm going through right now will pass. And everything in life is a transition. I will transition through this perimenopause into menopause, and that will bring a whole other world to me. So while I've been talking about windows closing, there's another one just about to open on the other side of this.
Oh, well, that was a beautiful way. So with that's a tough statement to follow, but that was beautiful. Thank you. And that's a wrap for today's episode of Second Opinion. I really hope you enjoyed it because I know I did. It was such an honor, Cliona, having you from across the pond. Just the way we met, just how this conversation just came up so organically. Just a big shout out to you for shining your insights on mental health, mindfulness, and balancing many roles that you play in life. I hope you've gained valuable strategies for prioritizing your self-care, navigating life transitions like perimenopause, and supporting your mental well-being with a holistic approach. If you've enjoyed today's conversation, please don't forget to subscribe, rate, and leave a review. It helps others find the show. And if you have a topic you'd love for us to explore, drop us a note. We're always looking for new ideas. I'm Rosemarie Beltz. Until next time, take care of yourself, get some rest, and remember, always get a second opinion.